So you know the caliber of the person you're talking today. I'm going to tell you a little bit about him. Dr. Frost joined the Alberta Neurologic Centre in 2023 as a physiatrist. Dr. Frost was drawn to physiatry as it was a perfect match for his interests and experience in both engineering and medicine. As a physiatrist, he focuses on the intricacies of nerve and muscle problems. As an engineer, his interests include helping children with spinal muscular atrophy enjoy physical play. Which is awesome. He completed his Master's of Health Sciences, Clinical Engineering at the University of Toronto in 2012, followed by a Doctor of Medicine at McMaster University in Hamilton, Ontario in 2016. From 16 to 21, he was a resident physician at physical medicine and rehabilitation at Vancouver Coastal Health in Vancouver, BC, and Director of Communications for Resident Doctors of British Columbia from 2017 to 19. In 2020, Dr. Frost co-founded the Financial Pulse, a financial literacy education program for resident doctors in British Columbia. From 21 to 23, he was a neuromuscular medicine fellow at the University of Calgary here in Alberta. Dr. Frost is also, I don't know where you find the time, is also the CEO of Raft Digital Therapeutics, a company that uses interactive gaming to make at-home physiotherapy programs more affordable, accessible, and fun. When not at work, Jeff loves a good board game, playing hockey, going for hikes, and skiing in the mountains. And I'm going to pass it over to you.
All right, Linda, we got to shorten that intro. That's
I know it's
we
pretty
need into
long.
our speaking time here. Hi, everyone. Yeah, so my name is Dr. Jeff Frost. I am a physiatrist. I work both at the Alberta Neurologic Centre and at the South Health Campus, where I'm an assistant clinical professor in the Department of Clinical Neurosciences. So today we're going to be talking about exercise and neuromuscular conditions, which is a particular passion of mine. So I'm really excited to be giving this talk today. Before we get started, I should give you some quick disclosures. So just so you know, I do not receive any financial incentive to give this talk. I'm happy to support the work of the Calgary Neuropathy Association without financial incentive. As Linda mentioned, I will say previously served as the CEO of Raft Digital Therapeutics. Linda correctly commented that she doesn't know how I find the time, and it's turned out that I don't really have the time. So I haven't done much work at Raft for about a year now. But yeah, Raft was attempting to commercialize therapeutic exercise in neuromuscular disease populations, so that's a clear disclosure you guys should know about. But I haven't really done anything for about a year there. Some other disclosures unrelated to this talk. I do something else in my medical life called spasticity management. These are all related to spasticity management. We're not going to be talking about that today, and it doesn't usually affect neuropathy patients, so I don't think it's that directly related to this talk. In terms of setting the stage, this is a group-based learning activity, so we're going to talk about exercise and neuromuscular conditions. No part of today's talk should be construed as direct medical advice for participants. So put another way, for the sake of today's talk, yes, I am a doctor, but I am not your doctor. And it's always good to get personalized medical advice, especially when you have significant conditions like some of our neuromuscular conditions can be. In terms of what we're going to be talking about today, we're going to be talking about evidence-based medicine. So that means medicine that's being published in academic journals and that has been peer-reviewed. I do recognize there are other knowledge-based medical traditions out there. We won't be exploring those today because, frankly, it's not my area of expertise. And then in terms of questions, they're welcome throughout the presentation. I'll try and monitor the chat box, but it can be a little hard to do talking and monitoring. But yeah, we'll try and take questions throughout the talk today.
Yeah,
in terms of what we're hoping to cover today, we've got 4 things we're going to go over today. So part 1 is just an introduction to exercise. We're going to be talking about what exercise is, breaking down what makes up an exercise routine, and exploring some exercise guidelines that are out there. In part 2, we're just going to be talking about exercise in neuropathy, the evidence for it, and how to implement exercise in your life if you have a neuropathy. Part 3, we're briefly going to touch upon exercise in myopathy because this is neuromuscular conditions. This can cover myopathy. I don't know if anyone here today has a myopathy. We will be going over this very briefly. And then finally, we're just going to talk about what an exercise prescription is, what it should look like, and how we can implement it in our daily lives. So, introduction to exercise. So what is exercise? Well, first we got to go over key definitions, everyone's favorite part of a talk like this. So when we talk about exercise, we kind of all intuitively know what it means, but it's worth going over like a rigorous definition. So the first thing is we have to start with the definition of physical activity, and that's any bodily movement produced by skeletal muscle contraction that results in a substantial increase in energy expenditure over resting levels. In plain language, if you move and you increase the amount of energy you're using, that's physical activity. Then we have this concept of lifestyle physical activities. So this is the daily accumulation of activities, including all planned or unplanned leisure, occupational, or household activities that are at least moderate to vigorous in intensity. So what does this mean? Well, this is like, for those of you that might have physically demanding jobs, like you work in a warehouse, or I don't know, maybe you climb the stairs at home a lot. These are all little activities you do throughout your day that increase your level of physical activity in a way that's at least moderate to vigorous in intensity. Whoops, sorry. Good old allergies. Yeah, so lifestyle physical activity, I talk about this a lot in patients who have physically demanding jobs because sometimes lifestyle physical activity can account for our daily exercise, although usually there's nuances that make our lifestyle physical activity not quite what we're looking for when it comes to an exercise routine for individuals with myopathy. Then there's exercise. So exercise is a form of leisure time physical activity that is performed repeatedly over an extended period of time. There is a specific external objective, like improving fitness, improving physical performance, or improving our health. So exercise and physical activity overlap, but exercise is a much more planned out, directed, and goal-oriented activity, where physical activity is your daily movement, doing stuff above and beyond just lying on the couch, but doesn't necessarily have the same planning or intent behind it. It doesn't have the same goal setting that we do with exercise. And so I'm largely going to be talking about exercise today, not physical activity or lifestyle physical activity. And no, there is very subtle differences between those two. So the other thing I always like to bring up when I talk about exercise is this concept of deconditioning. So deconditioning is this very complex process. It's pretty much the inverse of exercise. So when you exercise, your muscles get stronger. As your muscles get stronger, you can accomplish more. Deconditioning is the exact opposite. If you don't use your muscles, they become weaker over time, and it becomes harder to accomplish daily tasks like walking, climbing stairs, stuff like that. Deconditioning is, I like to say, kind of the dark side of the exercise continuum, because if we don't exercise, we experience deconditioning. And unfortunately, I see it a lot in patients with neuromuscular diseases for lots of different reasons. And it becomes an additive problem. So yes, you have a neuromuscular condition that makes it hard to move your muscles and bones the way you want to. And because of that, you stop exercising. When you stop exercising, you start experiencing deconditioning. So that makes your muscle function worse. So now we have two different problems making muscle function poor so that you can't get through your day-to-day activities like walking or going up and down stairs in a way that's safe and functional. So when it comes to neuromuscular conditions or neuropathy, we really want to avoid deconditioning and use exercise to do that. So to put it kind of in some plain language here, we all need physical activity in our daily lives. We can think of physical activity like a medication. We should be doing a certain amount of it every day or every week to maximize our health. Measured on a weekly basis, some of us, although I would say the vast minority of us, are going to get sufficient activity through our lifestyle physical activity. But for most of us, if we want to get the recommended dose of physical activity, so if we're going to take enough of that medication called physical activity, we're going to need to participate in exercise, which is a planned bit of physical activity that has specific goals in mind. And by doing this, we can avoid deconditioning, which can worsen the symptoms of neuromuscular disease. So I'm just going to quickly pause there because these are kind of opening definitions that we all need to be on the same page on if we're going to move forward here. So if anyone has any questions about any of these basic definitions, throw them into the chat here. We can try and clarify. If not, I'm happy to move on to talk about the different kinds of exercise that we see out there. All right, I'm not seeing any. So I'm just going to jump into the three main kinds of exercise that we talk about when it comes to neuropathy. So the three main kinds of exercise we talk about are aerobic exercises, strengthening exercises, and balance-based exercises. So aerobic exercise is any exercise that uses large muscle groups to complete a rhythmic endurance task. And when you're doing it, you feel it most in like your heart and your lungs. You're gasping for air, your heart's pounding. Think these are things like running, swimming, riding a bike. You're doing the same movement over and over and over again using those big, powerful leg muscles, and if, in the case of swimming, your arm muscles as well, and it's tiring you out. You're gasping for breath by the end of it. Strengthening is a little different. Strengthening is when you isolate a specific muscle group and move that muscle against resistance. So this is purposely trying to make a muscle stronger by making it move something heavy. This is basically lifting weights. And then balance-based exercises kind of combine resistance or strengthening exercises with sensory-based exercises. So we're trying to train our body's sensory system while strengthening muscles that work on balance to make you feel better in your daily balance tasks. So that's things like standing on one leg, being able to bend forward and backwards, that kind of thing. And a great exercise that exemplifies balance is something like Tai Chi or yoga. Both use a lot of sensory information in addition to some balance-based muscles to achieve an exercise routine. So today we're going to be talking about aerobic exercise, strengthening exercise, and balance-based exercises. I like to use a bit of a visual. Okay, we got a question here. Do strengthening exercises only improve cardio function? Actually, strengthening exercises we don't really think of as improving cardio function at all. Cardiovascular function is more aerobic exercises, Paul. So that's where you get your gains in cardiovascular fitness is through aerobic exercise. Strengthening, you get a bit of benefit from in your cardiovascular system for sure. But strengthening is mostly increasing the strength in specific muscle groups. So they achieve different things. Aerobic, cardiovascular, or cardiorespiratory, strengthening specific muscles. So I like to use a visual analogy when we're talking about
Can
exercise.
I throw a question? Sorry, can I
Sorry,
throw
Linda,
a question?
go ahead.
With the balance exercises and even the strength training, oh my gosh, I just had a brain fart and forgot what I was going to
No
ask
worries.
you.
But if you do remember, jump back
It'll
in.
come and I'll put it in the chat box.
No worries. So when it comes to exercise, I like to use this visual analogy. We've all heard that story about the Greek legend of the guy who had to constantly roll the ball up the hill and then it would fall back down the hill and roll the ball up the hill and fall back down the hill. And he was trapped in eternity doing that. And I honestly think of exercise like that for everyone, not just people with neuromuscular conditions. Doing exercise is hard. And I'm not going to tell you that it's not. It takes time. Depending on the exercise routine you choose, it may cost money. It can cause fatigue. And in the moment, it can even cause pain. None of these are really positive sensations. And so every time you're doing exercise, it feels like you're pushing that boulder up the hill. But once you get to the top of the hill, you start to function better, you start to feel better, you get an endorphin rush. There is something positive at the top of the hill. But because of deconditioning, that dark side of exercise lurking in the back, it's always pulling that ball back down the hill at the end of the day. The next day, the next week, you have to exercise again. It's not like you can climb the mountain once and you're done. Every day you got to do a bit of exercise, or every week you got to do a bit of exercise to keep pushing that ball up the hill, even though at the end of the day it starts to roll back down on you no matter what you do. So I always do like to admit that one of the hardest parts about seeing a physician like me who recommends exercise is that I'm actually asking quite a bit of you. If you think about it, when you go to most doctors, they give you a medication, they tell you to take it once a week, once a day, that kind of thing. It really isn't that hard to do, other than remembering to take it every morning when you wake up. But when I tell you to exercise, I'm asking for 30 minutes to an hour of your day. I'm asking you to do something uncomfortable. And I just want to recognize that that's hard. And it can be really hard when you have neuropathy. But I do know that it works. Or I should say, our best evidence in Western medicine shows that it works. And so while it is challenging, I always encourage everyone to try and participate in it, even though it can be hard. Okay, I see Linda's question here. Do balance and strength training exercises help prevent falls? Yes. Yes, they do, Linda. Very much so.
Even when you're losing sensation, because I feel like that's why I fell.
Yeah, no, that's a good question. So, I mean, this is where it kind of gets into the nuance with peripheral neuropathy. So in peripheral neuropathy, we do expect a slow decline in our performance in functional tasks. So things like balance and strength decline over time. Exercise, for some people, may not make them feel better, but what it will do is make that decline a lot slower. So It's really hard for me to say that it's better because instead of going to like a -10, we're going to a -5. Now, the difference between -5 and -10 is +5. So that is better. But compared to how you felt 2 years ago, 3 years ago, 4 years ago, there is still a slight decline in function. And so sometimes it can be hard to understand why we might want to do exercise because even when doing exercise, you may notice continual decline in function. But I can promise that if you stop exercising, your decline in function will rapidly accelerate.
Right.
And so I always tell everybody, yes, exercise makes it less likely that you'll fall. Yes, exercise helps with balance and strength, even if you think you're not getting better. Does that make sense?
Yeah.
Any questions around that? Because honestly, I spend like probably 2 hours a day going over that concept over and over again. I hope I have a good explanation since I
I
talk about
think
it so
you
much,
do.
but
We did have a question from Ron that was early on, and like he had a bicycle accident, was told about 5 years ago, had another accident. It would take 6 weeks for the soft tissue to heal. Does it mean that I should exercise or go to physio in regard to the injured parts until 6 weeks are
right.
up,
Yes,
or should you go sooner?
yeah, so
Especially
it's
given
like
he's
that.
80.
I don't mean to dismiss the question, but unfortunately, that really comes down to a personalized, a better understanding of the injury. I'd need to look at images. I'd need to understand the injury itself. Some
Okay,
injuries you can immediately start exercising. Some injuries you do have to spend some time not exercising. And unfortunately, it's just a little outside of the scope of today's talk to go into someone's personal medical history like that.
fair enough.
Um, I do see a question here about chronic fatigue syndrome. I believe that's what you mean by CFS. Um, how much exercise should be purposely limited when one has CFS? Yeah, so when it comes to chronic fatigue syndrome, it's all about activity management. And so that's finding out what your daily activity limit is and making sure you use up that activity limit on something purposeful and meaningful that will help you. I think exercise is one thing that can greatly help in chronic fatigue syndrome. And it largely comes down to understanding what is your activity budget for the day and allotting some of that activity budget to exercise. What is the best balance exercise for neuropathy of the feet? Alex asks. Alex, we're going to answer that question later in the talk. And depending on it, it seems more with poor mobility using a walker, but become dependent on it, and now seems more mental. Okay, Raymond, great question. Well, I don't know if this is a question, but I want to talk about this. So Raymond's talking about how using a four-wheeled walker, people can feel dependent on the four-wheeled walker, and I say, yeah, people can become dependent on the walker in a very positive way. So when I use walkers in peripheral neuropathy, I'm helping people avoid falls. And I always say if you can avoid a fall by using a walker, that's wonderful. I don't want people falling. That's always the worst outcome in peripheral neuropathy. And so if a walker helps you be active, but be active safely, that's awesome. And whether we call that a dependence or whether we call that an aid that really helps you get the most out of your life, you say tomato, I say tomato. But from my point of view, for the majority of my patients, when they start using four-wheeled walkers, it actually increases the amount of activity they do. And by increasing the amount of activity they do, they feel safer when they're walking and they have less falls. And so to me, that's a very positive outcome of using something like a gait aid. And Betty Lou, you just talked about the importance of core strengthening. Yeah, core strengthening is super important. That's part of balance-based exercises. Balance-based exercises include a core strengthening component when done properly. Okay, I'm just going to move on here. So breaking down exercise, what makes up an exercise routine? There's a whole bunch of different words we need to learn, and we need to learn what their meanings are if we're going to be able to have a conversation about what exercise is for you. So when we talk about exercise, there's a couple key definitions. Definition number one is frequency, which is how often per block of time you participate in exercise. I usually measure frequency on a weekly basis. So how many times do you exercise per week? Do you exercise 2 times a week, 3 times a week? That's the frequency of exercise for you. For almost everyone with neuropathy, I try to encourage 3 times per week minimum. 5 times a week is awesome. 7 times a week is blowing my mind. But that's kind of what we're looking at in terms of frequency. Intensity is how hard the exercise is. So there's lots of different ways of measuring this, and we're going to go into this in much more detail at the end of the talk. But intensity basically talks about how hard is the exercise. At the end of the day, it is something you perceive. So my 10 out of 10 intensity or max intensity may be different from Linda's 10 out of 10 max intensity, and that's okay. What matters is understanding what your 10 out of 10 intensity is and scaling your exercise so that you're doing the right amount of intensity for you. Duration is how long you exercise for, so that's pretty straightforward. 10 minutes, 20 minutes, how long are you exercising for? Repetitions is how many times you do a specific exercise within an exercise routine. This applies more to balance-based and strengthening exercises, not so much aerobic exercises. But say I talk about doing squats as part of my strengthening routine. If I do 20 squats as part of my exercise routine, then I've done 20 repetitions. And then there's this concept of sets, which is how many times you do a set number of repetitions within an exercise routine. So going back to squats, let's say I do 20 squats, but I divide it into 4 groups of 5. So I do 4 sets of 5 repetitions for a total of 20 repetitions. And these are all important terms to know because when it comes to prescribing exercise, we need to understand these words because that's how an exercise prescription will be written. So I did go through a little quick example here. So we have our friend Jenny. Jenny has Charcot-Marie-Tooth disease, but she still likes going to the gym. She tries going to the gym about twice per week for 1 hour. And while at the gym, she will spend 15 minutes doing some strengthening work and 45 minutes on the treadmill. When doing her strength work, she does squats 3 times, lifting 80 pounds with each squat. And each time she does squats, she'll do 5 squats at a time. She also does heel lifts. Again, she'll do them 3 times during her routine and 5 times every time she does the heel lift. So going through those words, let's make sure we understand the definitions. So frequency, that's how many times per week you're going to the gym. Jenny's going to the gym twice per week. So her frequency of exercise is twice per week. In terms of the intensity, I didn't write this out for her aerobic activity, but for her strengthening activity, when it comes to squatting, she's lifting 80 pounds. So the intensity of her squat is 80 pounds. When it comes to the heel lifts, she's lifting her own body weight. So that's 135 pounds. That's her intensity when doing the heel lifts. In terms of duration, that's how long she exercises for. Well, when she goes to the gym, she does 45 minutes on the treadmill. So that's 45 minutes of aerobic activity and then 15 minutes of strengthening. So that's 15 minutes of strengthening when it comes to duration. And then we can talk about repetitions. So for her aerobic activity, she's going on the treadmill once. So I just called that 1 repetition, but really you don't even have to specify. When it comes to her squats, she's doing 5 sets of 5 repetitions. She's doing 3 sets of 5 repetitions. So that's a total of 15 repetitions. For her heel lifts, she's doing 5 heel lifts, but 3 sets. So that's a total of 15 repetitions for her heel lifts. And she's doing 3 sets, as we talked about, for squats and heel lifts. So these are just important words to know what they mean. Because again, when we talk about exercise prescription, we're using words like this so that we're all speaking the same language. So again, I'm going to just pause rather quickly for any questions in case anyone has any about these core definitions, and then we'll keep moving on. And it also allows me to take a big drink of tea. All right. Seeing no further questions, let's talk about exercise guidelines. So exercise, oh, maybe there was a question here. Maybe it shows I have a cyst behind my left knee. Sam, I appreciate the question you've asked, but unfortunately I can't get into personalized medical advice, and you're kind of asking a very personalized question there. Catherine asks, since we're balancing the good numbers and mirror vibrations, yeah. So Catherine, we're going to talk about this later in the shot. So I'll just ask you to hold on to that question. We'll get to that. Okay, so exploring exercise guidelines. I really like exercise guidelines because they give us something to shoot for. And it's always nice to understand, when people say you should be exercising, well, what does that mean? It's kind of like when people say you should be eating a good diet. Well, what does that mean? What's a good diet? It's hard to understand what is good if you don't know what you're measuring against. And so exercise guidelines give us kind of a minimum floor that we should all be aiming to hit on a weekly basis. So we're trying to make sure we're doing enough exercise per week. And these exercise guidelines are based on years and years of scientific research into what makes what makes good exercise for individuals. So in Canada, we have 2 sets of exercise guidelines that I'm going to go over today. One is for adults aged 18 to 64. And so when it comes to adults aged 18 to 64, our exercise guidelines recommend that you do 150 minutes of exercise per week. It recommends that you break that into different activity sessions and that each activity session is at least 10 minutes in duration. When it comes to intensity, it recommends moderate to vigorous aerobic activities. And again, we'll talk about what intensity means when it comes to aerobic activities, because that is a bit tricky, but we're going to go into detail later. And then additionally, they ask you to include strengthening activities twice per week. And they tell you to work in light physical activities throughout your day. So light physical activities is standing or walking slowly throughout your day. And this little sentence is really aimed at all the office workers out there. Try and take time throughout the day to get up, move around, use that body. Don't just sit all day long. And then when it comes to the very last point, more is always better when it comes to exercise. These activity guidelines also talk about sleep because it's important that you get enough sleep for those muscles to feel better after a bout of exercise. And they recommend getting 7 to 9 hours of sleep per night. That does vary per individual. I know there's a lot of people out there who think they can sleep for 4 to 6 hours a night or something like that. We've done a lot of studies on this. There is a very small subset of people who can get by on 4 hours of sleep, but it's a vanishingly small number, and the chances of you being one of them are pretty small. And so a lot of we've convinced ourselves, myself included, from time to time, that we can get by on 4 to 6 hours of sleep. And really, that's just a function of our modern lives where we're always online, we're always on our phones. For the vast majority of us, a safe amount of sleep is at least 7 hours a day. And I know it can be hard to find time to make sure we're getting that 7 hours, but I always encourage everyone to try and make that part of your day because it is a big deal when it comes to helping nerves and muscles function properly. And then the last thing when it comes to activity guidelines, our Canadian activity guidelines have started to talk about sedentary time, which is great. And they're now talking about minimizing your leisure screen time to 3 hours per day. So hopefully this talk is only 45 minutes, but I'm still going to use up about a third of your screen time today just by listening to me talk. And then the other thing is they talk about sitting and breaking up long periods of sitting as often as possible. And that's something as simple as standing up, doing a quick lap around the house or lap around the office, and then sitting back down. Then there's also some activity guidelines for adults age 65 or over. To be honest, this is almost exactly the same. The only big difference is that it includes additional balance-based exercises. They encourage all elder adults to do some balance-based exercises in addition to strengthening and moderate to vigorous aerobic. And then you do actually need a little bit less sleep as you age. So 7 to 8 hours of sleep instead of 7 to 9. But otherwise, these are the same. So the big takeaway number is 150 minutes of exercise per week. They don't tell you how many times you should be doing exercise. From my point of view, it should be at least 3 times per week you should be doing aerobic exercises. And they also ask you to include strengthening and, for our purposes, balance-based exercises. I'm just going to quickly check the chat here. Oh, is the total body shaper a jiggle machine, aerobic or strengthening? That's Valerie asks. Valerie, probably neither. It's more of sensory feedback. It has shown some evidence in helping people walk more safely with neuropathies. But most of us think that comes through the sensory feedback. So improving your sensory nerve function rather than improving your muscle function. Andy asks, should we hydrate while exercising? Totally. When it comes to hydrating with exercise, I tell people to go by what their body tells them. If you think you're thirsty, drink. Sometimes we used to set like liters of water that we should drink per day, like 2 or 3 liters per water. To my understanding, that there's really poor evidence for that. And so the best evidence comes down to if you're thirsty, drink.
A lot of people
definitely hydrate while exercising. Is there any, and sorry, I'm reading Ron's question here. Is there any rotation the type of exercises for each day? So during a 3-day, Ron, if I understand this question correctly, you're asking if you should change the kind of exercises you do every day. The short answer to that is it's probably a good idea because it gives your muscles time to recover. But the longer answer is you don't actually necessarily need to do that unless you're doing a very vigorous intensity activity. If you're doing vigorous intensity activity, then you might want to give your muscles 2 to 3 days to recover. But if you're doing moderate intensity activity, you can actually probably do the same exercise every day if it's an exercise you enjoy. If sleeping is a challenge, does napping help? Wow, Lisa, asking the tough questions. So napping is probably beneficial for people who don't get sufficient sleep at night. However, the dark side of napping is we know that people who nap a lot also struggle to sleep the 7 hours we recommend at night. So I don't know. You know, if you can find a way to sleep the 7 hours a night, we think that's best. If you're having a hard time sleeping 7 hours per night, but like a 30-minute nap during the day helps you, that's awesome. Go for it. I would encourage you to try for like a whole week to not nap and see if that helps you get the full 7 hours of sleep at night. Do compression
Is
stockings
another
slow progression
option?
of peripheral neuropathy in feet and shins? Probably not. Compression stockings are mostly used for blood flow problems or venous congestion, which is a completely different disease, but can have symptoms similar to peripheral neuropathy or may worsen peripheral neuropathy if treated poorly. But compression stockings are largely for a totally different disease. Vidya asks, is walking good for CMT? Yep, walking is great for CMT, although I would call that low intensity activity, and ideally we're shooting for moderate intensity activity, which we will talk about later. Do muscles aching after exercise mean a hard stop for several days? Great question, Peter. Short answer, no. Muscles aching for about a day after exercise is acceptable. If you ever develop dark or tea-colored or Coca-Cola colored urine after a bout of exercise, that's a hard stop. If you have muscle aching that makes it difficult for you to achieve a functional task with that muscle. So what do I mean? If your biceps ache and you can't bend your elbow and your biceps are elbow bendy muscles, that's a hard stop. But if I worked out my biceps and they ache a little the next day, but I can still do everything I want to do with my biceps, that's not a hard stop. We should expect some achiness in muscles after exercise. Is a mini tramp all three types of exercise? Great question. I don't really know. I've never really used a trampoline. I think so. I'm just not sure how aerobic a trampoline would be, but certainly it would work on strengthening your leg muscles and balance for sure. I'm just not sure how hard it is. I don't know how much you're. I've never tried a trampoline, so I don't know.
It can be pretty hard if you
Yeah.
do it right.
Alex says, should you wear compression stockings when going to bed for neuropathy? Again, I don't recommend compression stockings for my neuropathy patients unless they also have vascular disease. However, it is common for patients with neuropathy to also have vascular disease. So a physician or healthcare provider may have asked you to wear them in the past. And that like checks out if you also have vascular disease, but it's not a direct treatment for neuropathy. Okay, exercise in neuropathy. First and foremost, drum roll, please. We're going to talk about the evidence for exercise in neuropathy. So I'm not going to go over all the different studies. I'm not going to go over the meta-analyses. Trust me that I've done this work. One of the better meta-analyses just came out 2 years ago by Streckman. And Streckman's big top line finding was that exercise has shown improvements in all domains of function that we measure for patients with peripheral neuropathy. So this includes people experience less pain, people experience less fatigue, people experience better balance, people walk faster, and people have better nerve conduction velocity. So for all the things we measure that we care about in scientific studies when it comes to peripheral neuropathy, people get better when they exercise. Now, is the magnitude of change massive? No, it isn't. Exercise is not a silver bullet that fixes all your problems. But I always tell patients, you know, a 5 or 10% improvement in pain, fatigue, balance, walking, nerve conduction velocity, it all adds up over time. And it's something we can do to better control our symptoms, even if it doesn't completely make them go away. Now, oh, I heard myself talking there. I'm not sure. Anyways, okay, I want to pause for dramatic effect here because this is kind of a big deal. And so evidence for exercise, I just want to go over this one more time. When we're looking at the evidence for exercise has shown an improvement in nerve conduction velocity. I cannot stress how important this is because better nerve conduction velocity is the holy grail of neuropathy research. We have been trying for decades to find a drug or a medication that improves nerve function in individuals with peripheral neuropathy. As Linda mentioned at the start of this talk, there is no drug on the market or no medication on the market that improves nerve function in individuals with hereditary peripheral neuropathy. We're working on it, and I hope we find one, but there is no medication that currently does this. So exercise does. Exercise is the only thing we've studied that shows an improvement in peripheral neuropathies in terms of conduction velocity and nerve function. So put another way, if exercise was a medication, every one of you would be on it, and I'd lose my medical license if I didn't prescribe it. It's that good. So some food for thought. I'll just leave that out there. And I put Toothless there. Toothless is from a movie called How to Train Your Dragon, one of my favorite movies. I recommend you watch it if you haven't. And Catherine asks, is it only about 5% in terms of improvement in conduction velocity? Yeah, Catherine, the changes in nerve conduction velocity are small. I'll grant you that, about 5 to 10%, depending on the study you're looking at. But you know what? That's a heck of a lot better than zero. And that's what every medication we have to date has done. I would argue it's infinitely better than zero if you think about it from a mathematical perspective. So yes, this is not a silver bullet. That's correct, Catherine. It doesn't make your nerve problems go away, but it is the only thing out there that does lead to an improvement in nerve conduction velocity. And so Lisa Kennedy asks, does this evidence apply to both large and small fiber neuropathy? Yep, totally. So if you look at the domains of function, this is a great question just for the anatomy nerds out there. Lisa is asking about large and small fiber neuropathy. So we think about small fiber neuropathy, Lisa, that's pain. If we think about large fiber neuropathy, that's balance and probably walking speed. And so we've seen improvements in the two domains of nerves that you're asking about, large and small fiber neuropathies. That's because the different caliber of nerves have different function in the human body. Okay. Implementing exercise. Whoa, sorry. Will exercise help reduce numbness and other CMT symptoms? Yeah, Vidya, we think it does. And again, I want to stress here that we're not talking about a silver bullet. You're not going to exercise and immediately have no CMT symptoms. If you exercise on a regular basis, I would expect your symptoms to decrease, maybe 5, maybe 10%. I totally understand it when patients tell me, well, 5%, that's not a big deal. That's not a big number. That's fair. That's totally fair pushback. But you know what? It's infinitely better than anything else on the market. And so that's why I always suggest it. And
Well,
to
and
be
if
frank, when you look at a lot of medications out there for things like high blood pressure, asthma, stuff like that, the best medications can have 5, 10, 15% effect on a disease. So even when we talk about other conditions with more better medications, the effect size is usually in the 5 to 15%. It's rare that we have a medication that completely changes the disease. Oh, Joan, wonderful question. Does alcohol make peripheral neuropathy worse? Thanks for this is kind of more into diet, but just very quickly, I want to answer this question. Yes, it does. Alcohol is a neurotoxin. That's why it makes us feel funny because the nerves in our brain respond to alcohol. And the nerves in our brain anatomically are very similar to the nerves in our feet and our hands. So, you know, if the alcohol makes your nerves up here feel funny, it's going to make the nerves here feel funny too. And so I do usually recommend for all my patients with peripheral neuropathy to decrease alcohol consumption. Ideally, don't drink any, but I also understand that everybody has to live their life. And if that means having a drink every now and then with your friends, that's totally fine. What I really want to discourage is regular alcohol use, like 2 to 3 drinks per day. That's probably not very good for your nerves. All right, so implementing exercise. So people always ask me, Dr. Frost, what is the best exercise I should do for neuropathy? Because there's lots of different exercises out there. When we look at the reviews that have been done, probably the best exercise combination is aerobic activities with balance-based activities. And some of you who saw me 3 or 4 years ago may remember that I was telling you to do strengthening activities, and that's honestly because the evidence has changed. Initially, we thought it was going to be strengthening activities, and for some conditions, like multiple sclerosis, the evidence does still point to strengthening being the best kind. But for people with general peripheral neuropathy, so that's Charcot-Marie tooth disease, length-dependent polyneuropathies, a diabetic polyneuropathy, the best evidence is for a combination of aerobic-based activity and balance-based activity. So what does that mean practically? If I were to pick 2 kinds of exercises for people with peripheral neuropathy to do, it would be to use a recumbent bike and to do some Tai Chi. Now, why a recumbent bike? People often ask me this. I find when people have peripheral neuropathies, it can be hard to balance safely. A stationary recumbent bike, like what's seen in this picture here, is usually pretty safe to get on and off of and doesn't have a high risk for falls. And we're going to talk about safety and exercise in a minute. That brings us to the golden rule, though. Yes, aerobic exercise is the best studied and shows the best evidence, but the golden rule of exercise is the best exercise is the exercise you'll do. And the corollary of that is doing some strengthening activity is infinitely better than doing nothing. So I don't want anyone to leave this talk and hear, well, Dr. Frost said the best exercise is aerobic and balance, and I don't like doing those. All I like doing is lifting weights. So I'm not going to do any exercise because strengthening isn't helpful. And that's the wrong message here. Aerobic and balance is probably the best, but honestly, any exercise is so much better than no exercise. So at the end of the day, the best exercise is the exercise you'll do on a regular basis, whatever that is. And that brings us to the silver rule, which is the best exercise is the exercise you'll do and the exercise that you can do safely, which is why I brought up the recumbent bike. It's always great to pick an activity that seems the best when we look at medical research, like, say, cycling. But then you have to make sure that exercise works for your body and it's an exercise that you can do safely. So I often the greatest example of this is I often tell patients to go swimming because swimming is a really good aerobic activity. However, many patients will tell me, "Why, Dr. Frost, I can't go swimming because it's hard for me to walk on the pool deck." And that's a great example of an exercise that sounds perfect. Swimming sounds perfect, but it has a practical limitation. Someone has a difficulty with balance that makes pools dangerous. So we shouldn't do that exercise no matter what the research says, because I don't want you falling and having a secondary injury. I want you to pick an exercise that's safe for you. And that's one of the reasons why I recommend recumbent bikes. Like I said, recumbent bikes are pretty easy to get on and off of. There's minimal risk of a fall when you're using them. And so it's a safe exercise that can work for your body. And so that brings me to the kind of the golden quartet, the 4 best exercises for peripheral neuropathy. I've picked 2 aerobic exercises and 2 balance exercises. So if I were to recommend the best kind of exercise you could do, if we're talking about balance, I would recommend either yoga or Tai Chi. Tai Chi is the most studied and is probably slightly better than yoga, but they're both excellent and good to try. And yoga even has some really great adaptive options like chair yoga. So that's a really good balance-based exercise you can try. When it comes to aerobic, I like to recommend cycling as a first line for most patients, but a form of adaptive cycling that's safe for you. So if that means recumbent cycling in a seated position, awesome. If you feel more confident with your balance and you can do road cycling, I mean, that's great too. And then failing that, I also recommend swimming. Swimming is a really good all-around exercise because it has a little bit of a strengthening component, and it also really helps for individuals with lower back pain problems. And I know many of our patients with neuropathies end up developing lower back pain problems. It doesn't have anything to do with their neuropathy. They just, as we all age, we tend to develop back pain problems. And so if you're someone who has a back pain problem, swimming is awesome because it kind of does double duty. It does your aerobic exercise while also helping with back pain. So I'm just going to pause here to look at the chat because I see there's a whole bunch of little chat things here. Can a non-diabetic have neuropathy? Yes, a non-diabetic can have neuropathy. Alex, that's a really long question to answer. The why part of that question, that's like an hour-long lecture. So I'll just say yes, a non-diabetic can have neuropathy. Well, are QB elliptical machines useful? Short answer, and yes. That's an excellent aerobic-based exercise that is safe for some patients. That's like the safe way to do aerobic exercises. Go for it. And then there's another question here about an elliptical. Yeah, ellipticals are great. Ellipticals are a form of exercise that's aerobic for most patients if you're doing it correctly, and it's low impact, totally up for an elliptical. Okay, I'm going to quickly talk about exercise and myopathy. Looking at the time here, we got 10 minutes left, so we're gonna do this part quickly. So myopathy is a different kind of disease that sometimes that does get classified under neuromuscular. So again, I don't know how many people here have myopathies. Exercise is still a really good idea in myopathy, but we have to be a lot more thoughtful about how we implement exercise in myopathy. We have to make sure that you're in a low to moderate zone for some of the metabolic myopathies. So really what I'm trying to say is if you have a myopathy, you should still exercise, but you really should seek out tailored medical advice specific to your condition and to your function. I can't give generalized exercise advice to patients with myopathy. It's a much more individualized plan. Where patients with neuropathy, I can say generally, yes, exercise is great. We should all be doing it. For patients with myopathy, there's just a little more nuance there. And I would want you to speak with your healthcare provider before starting an exercise program because we wouldn't want you running into trouble. And there is a risk of running into trouble with myopathies, much less so in neuropathies. But the big underlying thing I want to triple stress here is exercise is still good in myopathy. And I would want everyone with a myopathy to be exercising. We just have to be a little thoughtful about how we implement it. And I see the chat going wild here. So should I give up doing planks? No, that's wonderful core exercises, Ron. Keep doing that. Raymond, what is a myopathy? A myopathy is a disease of muscle. A neuropathy is disease of nerves. So with people who have diabetic peripheral neuropathies, their nerves have been damaged. People with myopathies is typically an autoimmune or degenerative process, something like inclusion body myositis. Your own body's immune system attacks muscle fibers and damages muscle fibers. Can I recommend a certain brand of elliptical machine? Certainly not. That would be some kind of ethical violation. I am not advertising for any company here. Does acupuncture help with neuropathy in the feet and the shins? Joan is asking. And yes, acupuncture can help with symptoms of neuropathy, so it can help you feel better. It doesn't change nerve function, so it doesn't make the neuropathy better. It makes you feel better. Okay, who diagnoses myopathy? People like me. So physiatrists or neurologists are typically the people who diagnose myopathies. We have to see you in the context of an electrodiagnostic test, which was my last talk for the Calgary Neuropathy Association, talking about electrodiagnostic testing and how we use it. Okay, part 4, exercise prescription. So this is kind of the most important thing. Exercise intensity. Exercise intensity is the perceived difficulty or degree of difficulty that you experience during an exercise. So a successful exercise prescription begins with understanding what degree of intensity we're going for when it comes to our exercise routines. And when it comes to defining exercise intensity, we use 2 scales usually for patients. The first is the modified Borg RPE, or rate of perceived exertion. That's RPE, rate of perceived exertion. And this is basically, you score yourself on a 1 to 10 scale for how hard you think the exercise is. It's kind of like that pain scale we ask you about all the time. 1 means it's not hard at all. So that's like watching TV. That's a 1 out of 10. 10 is it's almost impossible to imagine doing this repeatedly. So I usually think a 10 out of 10 on the RPE scale is your single repetition maximum for lifting a heavy weight. So if I were to squat, I'm going to flatter myself and say 180 pounds. That's probably my 10 out of 10 RPE exertion. I can't squat more than 180 pounds. If I tried to, I'd collapse into a heap and maybe cry. And so that's my 10 out of 10 on the RPE scale when it comes to squatting. And then in between, everything in between is kind of a self-perceived scale. So if 180 pounds is my maximum and sitting on a couch is my minimum, from 0 to 180, I would then assign a number. You know, if I'm doing maybe 40 pounds, that's not very hard. So I'd call that light activity. I'd call that a 2 on the RPE. And again, the RPE is a personalized scale. I get to define how hard exercise is. Maybe when I'm lifting 100 pounds, I'm starting to feel it, but it's not that hard. So I'll call that a 6, or moderate activity on the RPE scale. And then maybe when I'm up to like 160 pounds, that's near my single rep maximum. So that's getting really hard for me. Like I'm feeling it. I might be able to do 2 or 3 repetitions. So I'll call that an 8 on the RPE scale. When it comes to our neuromuscular, and we can use this for both aerobic activity and strengthening activity, you know, a sprint when you're running might be a 10 out of 10 on the RPE scale. Whereas again, sitting on the couch is a 1. And then there's everything in between. When it comes to a light jog, a fast jog, running uphill, we start to climb in the RPE scale. So when it comes to neuromuscular conditions, we really want to sit in a range of 2 to 3. So we want to be in the light activity or moderate activity. Sometimes we want to push into vigorous activity as well. And so that means when we're doing an activity, when we're doing an exercise, we should be thinking about where we think we are on this scale. We want to be like 5 to 6 most of the time. Maybe sometimes pushing it to a 7 or an 8. And that's just the concept to have in your mind. How hard is the activity I've chosen for me? And where am I on my personal scale? Am I a 5 or a 6? Cool, that's where I should be sitting. If when I do my exercise, I'm a 1 or a 2, I'm probably not exercising hard enough. If I'm a 9 or a 10, I'm probably going a little too hard and I might need to slow down or change the exercise I've decided to participate in. So that's modified Borg. The other one, which is probably even easier to understand, is the talk test. And so that's where you try and speak while exercising. If when doing an exercise, you can have a normal conversation, that's light intensity. That's easy to do. If when you're exercising, you can kind of say a few words at a time, but you couldn't really speak a whole sentence, that's moderate intensity activity. And again, moderate intensity activity is where we want to sit for our neuromuscular conditions. And then if when you're doing exercise, you could barely get a word out, like you are struggling, even saying one word is challenging, that's high intensity or vigorous intensity activity. That's probably pushing it a little too far for most of our neuromuscular conditions. So when we're doing exercise in neuromuscular conditions, we want to think about where we are on the talk test. We want to think about where we are on the RPE scale. Again, RPE, we want to be 5, 6, moderate intensity. Talk test, we want to be able to say a couple words at a time, maybe not a full sentence, but we definitely want to be feeling it. If I can have a full conversation, if I can sing, I'm probably not exercising hard enough. So, and this is just a little diagram that summarizes those two scales put together. So again, we're aiming for the 4 to 6 on the RPE, which means you're breathing more heavily. You can carry on a conversation, like get 1 or 2 words out at a time, but it's hard to do. And that green zone, that's where we want to hit when we're doing exercise in neuromuscular conditions. Okay. I'm going to quickly check the chat here once again. Are you familiar with LDN? I'm not sure what that acronym means, so I can't talk about that. What if exercise increases fasciculations and cramping? Catherine, usually that means you're either exercising too hard or not exercising enough. Cramping or fasciculations can be a sign of deconditioning as well. And so that's one where I'd have to dive into in more detail to better understand why you're getting that cramping and fasciculations. How can I get an appointment with me? Okay, well, Ron, great question. I am a tertiary subspecialist. What does that mean? You have to see a neurologist, and if the neurologist wants you to be seen by me, the neurologist refers you to me. So your family doctor refers you to the neurologist, and then the neurologist will refer you to me. I work out of a hospital where I treat neuromuscular conditions in Calgary. That's the South Health Campus. The unfortunate truth about people like me is that there's very few of us. There are currently 3 of us in Calgary, and I'm one of the 3. And so it is hard to get an appointment with me. Yeah, that's unfortunately how our healthcare system works here. Is there anything that can be done for burning feet at night? Yep, there's lots that can be done for that, Elaine. The big thing would be both exercise and oral medications. Unfortunately, I can't go into the oral medication side of things here today. I just don't really have the time, but there are oral medications that can help with that. Lynn asks, do these principles apply to peripheral neuropathy acquired post-chemotherapy? Wonderful question. That's CIPN. And the short answer is yes. The 2 most studied forms of peripheral neuropathy are diabetic peripheral neuropathy and chemotherapy-induced peripheral neuropathy, and they both show similar responses to exercise. So improvement in balance, less pain, less fatigue, better walking speed, and improvement in nerve function when we do nerve testing. Can you recommend any good shoes for CMT? Vidya, at a very high level, you want shoes that have a really thick sole. I know I'm not supposed to recommend brands, but there are shoes if you go to the shoe store that have a really thick sole with also a high ankle. You want a high ankle because that gives you more support when you're walking. And finally, you want to make sure that they have a wide toe box. A wide toe box prevents pressure from building up on your feet, which can cause injuries in peripheral neuropathy. And then Deirdre asked me to repeat what I said about vascular difficulties. So vascular difficulties, Deirdre, are a completely different kind of medical problem. So like that would be like when you have venous insufficiency is the medical word, but when you don't get blood going from your feet back up to your heart because your veins aren't working that well. So that's not a neuropathy at all. And that's the main indication for compression stockings. So we use compression stockings for blood vessel problems. We don't really use compression stockings for neuropathy issues. All right. I think I've answered. Are you low dose naltrexone? Yeah, low dose naltrexone. Raymond, the evidence for low dose naltrexone from my point of view is I haven't been overwhelmed by the evidence. I do have some patients that are on it and they say it works. I never get in the way of success, but I haven't found the evidence to be overwhelming. It's not part of my practice to routinely prescribe it because the evidence isn't convincing. Is it advisable to use a massage machine for neuropathy? Alex, if you can afford it and it makes you feel better, go for it. It's not going to make your nerves any better, but there are lots of patients who tell me it makes them feel better. So if it makes you feel better and you can afford it, go for it. It's pretty low risk. Joan, I'm happy to hear that LDN worked for you. And does anemia cause neuropathy? Alex asked that. Yeah, in like rare cases, really bad anemia can lead to worsening of neuropathy. Can lead to worsening of neuropathy symptoms. It is not a common cause of peripheral neuropathy in North America. It would be a very, very unusual case for someone to have neuropathy from anemia. Okay, I think I have like 3 minutes left. So 2 minutes. Oh my goodness. Okay, so exercise prescription. I just want to quickly go over this. When it comes to exercise, the more time. Oh, sorry. The higher intensity you exercise at, the less time you have to spend doing it to get the same benefit. However, there's a push and a pull there. We don't want to do super high intensity exercise in neuropathy because that can lead to secondary injuries. So high intensity, that's like CrossFit and crazy stuff like that. So for most of us, we want to be in the moderate or low intensity zone. But If it's moderate intensity, that means we have to spend more time doing it. And if we're in low intensity zones, we have to spend much more time doing it. So understand that there is a trade-off here between intensity and time. The less intense, the more time you have to spend doing the exercise to get the same benefit. So when I see, this is a prescription pad that I have written for a patient that I want to exercise. And so on my exercise prescription, I talk about what I want them to do, how often I want them to do it, the intensity I want them to do it at, how long I want them to do it for. So here I've written a prescription for swimming. So I've written the modality, swimming. I want the patient to do it twice per week. In terms of the intensity, I want it to be moderate on the RPE or hard to maintain a conversation on the talk test. And then I want them to do it for 30 minutes. This is the kind of thing you should be pushing your healthcare provider for. Is I know I should be doing exercise, what should it be? And this should either come from a physiotherapist, a kinesiologist, or someone like me, a physiatrist. And so I haven't actually, if I'm being honest, I haven't been giving out too many of these lately because I work in a wonderful clinic with a physiotherapist where the physiotherapist does this part of the assessment for me. But for those of you who live outside of Calgary who don't have the opportunity to come to our clinic, when you're talking to your healthcare provider, ask them, like, what exercise should I be doing? How often? What intensity? For how long? Because these are all things that can help you feel better when it comes to peripheral neuropathy. At a high level, the majority of us, like I said, should be doing aerobic exercises, balance-based exercises for a total of 150 minutes per week at a moderate intensity. And so that's kind of the high level of what we should be doing for exercise in peripheral neuropathy. And like I said, talk to your healthcare provider. And it might be me for those of you who live in Calgary, or it might be Michaela, our physiotherapist, and ask for an exercise prescription. Because, and at the end of the day, if you're having a hard time accessing care, don't be afraid to watch this talk back, go over those words that we talked about, frequency, intensity, duration, repetition sets, and set yourself an exercise prescription. Say, you know what, I want to exercise more often. I'm going to tell myself to use the recumbent bicycle twice per week. That's my frequency. I want to do it for 20 minutes. That's my duration. In terms of intensity, I want to hit a 5 on the RPE, or I want to find it difficult to maintain a conversation on the talk test because that's moderate intensity activity, which is what we're aiming for. Challenge yourself to do that and then stick to it, because we should be treating exercise like a medication. It has better results than all of the medications out there. And I personally have seen in patients that can stick to an exercise plan over the long term, I've seen improvements. And so I know it's something that works. But I also know it's hard to do. I also know it takes up a lot of your time. And so I recognize that this isn't the easiest task in the world that I'm making. But that's it. That's everything I was going to cover today. I think we barely finished on time. I will stick around for a couple questions here if anybody has any questions. But first of all, thank you very much for your attention today. I really appreciate it.
Are you able to hear me?
Yeah, I can hear you, Linda.
Oh, okay. For some reason, I thought I wasn't able to be heard.
I just want to quickly answer this. Ask you this. Betty Lou, you've asked about row-based exercises. Love them. That's both a strengthening and an aerobic component at the same time. Huge fan of row-based exercises. Yeah. And Allison, one more time. Yeah, 150 minutes 3 times per week at moderate intensity. So that's 150 minutes broken up over the week. So it would be 50 minutes per session if you're doing 3 sessions. Or sorry, if you have a frequency of 3, then it's a duration of 50 minutes, 3 frequencies with a frequency of 3 bouts, totaling 150 minutes, going for moderate intensity. AFOs, Raymond asked about AFOs. AFOs are great for people with peripheral neuropathy, kind of outside the framework for this talk, Raymond. That's a totally different talk. That would be like a whole other hour of talking, but AFOs are great.
Okay.
Okay, I think that's it.
I know you have to get back to work, so thank you so very much.